Dear viewers, Assalamu alaikum and good evening. I welcome you all in this program, Specific Learning Disability Diagnosis to Management, organized by Faith Bangladesh. সুপ্রিয় দর্শকবৃন্দ, আসসালামু আলাইকুম। আমি নীলুফার আহমেদ করিম, নির্বাহী পরিচালক ফেইথ বাংলাদেশ। সবাইকে আমন্ত্রণ জানাচ্ছি ফেইথ বাংলাদেশ আয়োজিত ফেসবুক ভিত্তিক আলোচনা অনুষ্ঠান মুক্ত আলাপনে। আমাদের উপমহাদেশের প্রেক্ষাপটে শিশু বড় হওয়ার সাথে সাথে বাবা মায়ের টেনশন শুরু হয়ে যায়। বাচ্চাকে কোন স্কুলে ভর্তি করব, বাংলা মিডিয়াম নাকি ইংলিশ মিডিয়াম, কোন স্কুলে পড়াবো, স্কুলে ঠিকমতো পড়াশোনা করতে পারবে তো? আবার বাচ্চাকে স্কুলে দেওয়ার পর শুরু হয় আরেক টেনশন, বাচ্চা স্কুলের হোমওয়ার্ক ঠিকমতো করছে তো, টিচাররা ঠিকমতো বাচ্চার কেয়ার করছে তো স্কুলে? এই কম্পিটিশনের যুগে বাচ্চা ক্লাসে প্রথম দিকে যদি না থাকে, তা যেন একটা মান সম্মানের ব্যাপার হয়ে দাঁড়ায় বাবা মায়ের জন্যে। কিন্তু অনেক সময় দেখা যায় শিশু কোনো একটি বা একাধিক বিষয়ে অস্বাভাবিক খারাপ ফলাফল করছে, অনেক চেষ্টা অনেক পরিশ্রমের পরেও। অনেক সময় পরবর্তী ক্লাসে উত্তীর্ণ হওয়াটাই শিশুর জন্য দুষ্কর হয়ে পড়ে। ফলশ্রুতিতে শিশুটি ও শিশুটির পরিবার হতাশাগ্রস্ত হয়ে পড়ে। সবচেয়ে বেশি প্রভাব পড়ে শিশুটির মানসিক স্বাস্থ্যের উপর। পড়াশোনায় সকলের সাথে তাল মিলিয়ে চলতে না পারার কারণে পরিবারের চাপ, সহপাঠীদের অসহযোগিতা, এমনকি শিক্ষকদের কটু কথা শিশুটিকে করে তোলে মানসিকভাবে বিপর্যস্ত। আর আমরা আমাদের সমাজ শিশুটির ওপর দোষ চাপিয়ে দিচ্ছি, পড়াশোনায় মন নেই বলে। কিন্তু আসলে কি আমরা জানি শিশুর পড়াশোনা করতে সমস্যা হওয়াটার পিছনেও অনেক কারণ থাকতে পারে। আছে লার্নিং ডিসেবিলিটি। Specific learning disability, this issue and its management is somewhat new in Bangladesh. So today we'll get ideas from these experienced people, those are with us today. আজ আমাদের এই অনুষ্ঠানে আমরা জানব স্পেসিফিক লার্নিং ডিসেবিলিটি এর নির্ণয় ও চিকিৎসা সম্পর্কে। আর আমাদের মাঝে আজকে উপস্থিত আছেন, আমি তাদের নাম বলছি। Today we are fortunate to have some very, very experienced people on this issue. They are with us. They are Mr. Johir Ibrahim, eye care professional with special interest in learning disabilities in the autism spectrum. He is joining from UK. We have with us Mrs. Rajuni Banerjee, sign language interpreter, special educator, and she's joining from Kolkata, India. We have with us Dr. Himani Narula, development behavioral pediatrician, Delhi. She's joining us from Delhi. যেহেতু এই বিষয়টি বেশ নতুন আমাদের কাছে, তাই এই বিষয়ে বিশেষজ্ঞদের কাছে স্পেসিফিক লার্নিং ডিসেবিলিটি কি, কিভাবে তার ডায়াগনোসিস বা নির্ণয় করব, এবং এর থেকে উত্তরণের উপায় কি, আর এর ব্যবস্থাপনা কি করা উচিত হবে। Since specific learning disability, its diagnosis and management quite a new subject to many of us, especially to parents and even to the teachers. We'll hear from the experts, our guest speakers first, and then after the presentations, we will invite questions from you. Now I have some actually questions to my guest speakers today. First, I want to ask Dr. Himani that you are a doctor, but what motivated you to choose this profession or working with children with special needs?
Yeah, thank
Dr.
you.
Himani.
Yeah. First of all, am I audible? Yeah. Nilofer, am I audible?
Yes. Yes.
Okay. A very good evening to everyone, and thank you, Nilofer, for that kind introduction. And I would like to thank Faith Foundation also for making me a part of this webinar and giving me a chance to interact with everyone and the audiences across the country. How I got motivated is I was primarily a pediatrician, a general pediatrician, which we also called as a child specialist. And I used to work in NICUs, neonatal ICUs, pediatric ICUs, and I used to see a lot of children in my general OPD also on autism or learning difficulties, various neurodevelopmental disorders. And it used to be a challenge managing them alone or guiding the parents single-handedly and then creating a bunch of people or interventionists who would be able to take care of these children all in all. So it used to be a huge challenge working in a multi-specialty hospital. That is when I decided to do a further training in developmental pediatrics from Kerala University. And then I went into practicing and diagnosing and looking after children with all kinds of neurodevelopmental behavioral disorders and planning their treatment intervention, coordinating the therapies with all the different specialties like speech therapists, occupational therapists, special educators, and all other specialties who are required to take care of these children. That's how, and then I also created a facility in India by the name Continua Kids, which is like a small chain of child development centers across North India. We have 8 units, which collaboratively have a multidisciplinary child care centers where all needs of children with special needs are met, right from diagnosis to intervention.
Okay, thank you, Himani. And I think I can ask Rajini. Rajini Banerjee, you can speak also. You're from Kolkata.
Yes.
So it's my favorite place for shopping and rowing and on. So, okay. So you are a sign language interpreter and a special educator. And what made you to go into this field? You work in a school for the deaf. What challenges are commonly faced by you and the children? So you can use Bangla, English, both. Bangla would be much better.
আমি বাংলাতেই বলছি। আমি এই বাচ্চাদের সাথে কাজ করতে গিয়ে প্রথম যেটা ফেস করি সেটা হচ্ছে সবাই বলে ওরা তো কথা বলতে পারে না, বোকা, কালা, পাগল, এই বলেই ওদের আর কি ট্রিট করা হয়। তো এখানেই আমার অবজেকশন এবং এটা নিয়েই আমার কাজ করা যে ওদের একটা সম্মান আছে, ওরা শুনতে পায় না, ওদের শোনার অক্ষমতা আছে, বাকি ওরা আমরা সাধারণ মানুষদের মতোই ওরা আমাদের থেকে সুযোগ দিলে ওরা আরো অনেক বেশি এগিয়ে যেতে পারে। তো এটা নিয়েই আমার কাজ। যেহেতু আমার ফ্যামিলিতে আমার দাদু অধীর ছিলেন, তো আমি আমার দাদুকে ছোটবেলা থেকে দেখেছি, আমার বাবাকে পরবর্তীতে দেখছি, তো সেখান থেকে এই ফিল্ডে আসা এবং আজ 9 বছর হয়ে গেল আমি সাইন ল্যাঙ্গুয়েজ নিয়ে কাজ করছি এবং 11 বছর হলো আমি স্পেশাল এডুকেশন নিয়ে কাজ করছি। আমি কলকাতাতে একটা আর্মি স্কুলে আছি যেখানে আমি স্পেশাল এডুকেটর হিসেবে কাজ করি। এইভাবে আমার জার্নি চলছে।
এত বছর কাজ করছেন রজনী, আপনাকে দেখে কিন্তু মনে হচ্ছে না। Thank you so much. So is it easy to learn sign language, and are there any training courses that people can take if they want to learn? এরকম কি কোনো ইয়ে আছে, প্রশিক্ষণ নেওয়া যায় বা ট্রেনিং নেওয়া যায় সাইন ল্যাঙ্গুয়েজের উপরে?
এটাতে 2 বছরের একটা ডিপ্লোমা কোর্স আছে যেটা AYJNIHH মুম্বাইতে হয়। এখন দিল্লি একটা সাইন ল্যাঙ্গুয়েজ রিসার্চ ইনস্টিটিউট হয়েছে, এখানে 2 বছরের কোর্স, ফুল টাইম কোর্স। এটাতে কোনো শর্ট টাইম কোর্স নেই, কোনো পার্ট টাইম কোর্স নেই। 2 বছরের ডিপ্লোমা কোর্স, ABC 3টে লেভেল করানো হয় এবং সাইন ল্যাঙ্গুয়েজ খুব একটা কঠিন নয়। আমরা মনে করি সাইন ল্যাঙ্গুয়েজ খুব কঠিন, আমরা যদি খুব ভালোভাবে লক্ষ্য করি এবং ওদের ওই সাইনটা বোঝার চেষ্টা করি তাহলে কিন্তু আমাদের পক্ষে বোঝাটা খুব ইজি। কারণ আমরা প্রতিদিন লাইফে অনেক কথাই যখন বলি জেস্চার পশ্চার ইউজ করেই কথা বলি, সেগুলো খুব কম এবং এটা খুবই ইজি, শেখাটা খুবই ইজি, কিন্তু প্র্যাকটিসটা করতে হবে, নাহলে ভুলে যাবে।
তা ঠিক। হ্যাঁ, আমাদের বাংলাদেশে এখন অনেক সময় আমাদের দেখা যাচ্ছে যে আমরা টেলিভিশনে যখন নিউজ রিডার নিউজ পড়েন বা আমাদের অনেক বড় বড় প্রোগ্রাম গুলোতেও দেখা যায় যে পাশে একজন সাইন ল্যাঙ্গুয়েজে হ্যাঁ, উনি উপস্থাপনা করছেন বা প্রেজেন্টেশন করছেন। হ্যাঁ, হ্যাঁ। তো ঠিক আছে রাজনী, আমরা তো আপনাদের কাছ থেকে আরো শুনবো এবং আমাদের অডিয়েন্স তো আপনাদেরকে কিছু প্রশ্ন করবেই। তো আমি এখন আসছি to Mr. Jahir Ibrahim, the main initiative he took for this program, and is eye care professional, and you are joining from UK. So your profession is seems to be outside the normal professional
correct,
field. Yes, associated in learning disabilities. And what motivated you to work in this field? Mr. Jahir, yes.
It's a very interesting field. Good evening, everybody, and thank you for joining. Thank you for joining us. Hopefully, we can learn something from this program and take the knowledge back. Well, my background, as has been introduced, I am a professional, eyes. I work with eyes. And this is how I started in this field. A lot of people came to ask me about dyslexia, if dyslexia and learning are connected through the eyes. And yes, it is. And this is from here that my active work and research work took place in this field, because visual processing in the main is affecting how we process and think, and in learning difficulty, it is part and parcel of the problem. So visual processing is a key in the information we receive, because everything we see and do is through the eyes. Hence, the work expanded here. And from here, we worked on to see how children affected with this issue had other issues connected as well, because there is comorbidity, or comorbidity means other associated conditions with it. So learning difficulties, where the main focus of concentration was in education, the visual processing was an issue, and then we worked from there. So this is how I got into it, from a visual processing angle, to see if we could improve things for children who are having learning difficulties.
Okay, thank you. Thank you, Mr. Jahir. And now I think that it's time that we can start the presentation. But I'm really sorry to share with you that Ms. Masrat Mazid, one of our guest speakers, she yet could not join, but we can wait for her, but we can now go for the presentation. So I would now request Mr. Jahir to take the lead now for the presentation and present the slides one after another on this subject. And after the presentation, the audience will have the opportunity to ask you questions.
Okay.
Or you can just finish all the presentations, or maybe in between, or maybe after some presentation of some slides, or maybe some issue, then also we can ask audience to actually join us with through some questions to us. It's up to you. It's very flexible. Okay. So, Mr. Johir, it's to you. Okay, now you can start the presentation. Yeah.
Thank you. Thank you. Thank you very much. As everyone can see, the first slide that we have here is called specific learning difficulty. And our focus for this evening will be on here. And this is in part one. Okay. Part one is to do with specific learning difficulty and a background to what we do in specific learning difficulty. Next slide, please. Next slide, please. Okay. Now, one of the concepts I've introduced in my webinars is sign language. And the aim of sign language uses in webinars is to show that there is an alternate method of non-verbal communication that can be used in education and at home. It is a two-way conversation between people and doesn't cost much or need updating. So this is a different format that can be brought in, especially I want to introduce this in the schools. Sign language is not disability stigma, but a stopgap or continuous communication tool. Next slide, please. Okay, as you can see, there's an introduction as people, the guests that we have, these are introductions, and this is our background. So it just gives you an idea that all of us have come together to hopefully meet everybody there and enjoy an evening of information. Next slide, please. Okay, so part one in specific learning disability diagnosis and measurement. In the first bit, we were going to look at what parents notice, what the school notices, how does the school go about doing an assessment, neurological assessment, cognitive disorders, sensory disorders, crossovers, comorbidities, what children bring along. So this is like a complete overview of what is happening or what the children are bringing along and what the children can have that we need to be aware of. Next slide, please. Okay, so the first one is parents notice a difference. Now, I'll develop differently comparing to other children of a similar age of the child. So parents are starting to notice the child is not like meeting up to what they expected or the milestones they have read, or comparing it to other children. Development milestones are behind. Behavior milestones, not language milestones behind. The child may have other issues like sensory issues, light, noise, touch, smell, and food aversions. So this is something we commonly see. Coordination issues like fine motor and gross motor skills. The child could be clumsy, banging and tripping into things. Postural problems. The child has hyperactive behavior, not sitting in one place, fidgeting around in the chair, climbing, jumping on things. Child even may have sleeping problems. So this is just a few of the things that come into notice that the child is not the same as others when parents are making a comparison to other children of a similar age group. Next slide, please. The teachers notice a difference. We had a parent noticing a difference, that milestones are not being met, etc., etc. Here we have the school noticing a difference. The child is struggling with reading, writing, spelling, difficulty with words and sounds, writing and language, not age appropriate. Not fathom language, maths, concepts. Attention and focus is poor, or could be hyper-focused on other things. Fidgets, disturbs others, doesn't listen to instructions. Work performance is below average, yet verbally, the child is brilliant. So the child can be brilliant, but yet is struggling with reading, writing, and math concepts. The child is behind of the peer groups in class, and child is different to the peer group. So the school is starting to notice that something is not quite right, and something is not quite happening with the child, that he should, he's behind his peer group. So that is something that we need to be aware of and we notice in the classroom. Next slide, please. Dr. Imani? Dr. Dion, take over your slide. That one's done. We need what is specific learning disability. That's the next slide. And here, Dr. Himani will take over.
How parents and teachers.
Dr. Himani, are you there?
Are you able to hear me? Are you able to hear me?
Yeah, you're audible.
Yeah. So we have already heard from Zahir how parents and teachers express their concern about various challenges that the child is facing as far as reading, writing, studying is concerned, and maybe he's not able to cope up with the routine academic skills. So that brings to our mind that child is able to do all other activities all right. He doesn't seem to be intellectually disabled, or he doesn't seem to be like जिसे कहते हैं ना, हम मंद बुद्धि तो नहीं लगता है बच्चा, but again, why my child is not able to cope up with studies, why he doesn't want to write, why he's so fidgety, why he's so inattentive in class. So these concerns, when are raised by teacher or observed by parents, should raise an alarm in our mind. The child seems to be doing well when you take an exam orally. If you tell him to answer a question verbally, he'll answer. He will be able to recall certain things. He can tell the events happened, but he cannot read and write. And at the time when you make him read or write, he throws all kinds of tantrums, avoidance, and all those symptoms that Zahir spoke of will be there. So then specific learning difficulty is something that we start thinking about. So what is it? Specific learning difficulty is a neurodevelopmental disorder of biological origin. That means either it can have some amount of inheritance, or it can have some factors during the pregnancy, prematurity, mother being exposed to smoking alcohol, or to some kind of viral infections. All those factors, multiple biological factors, which can lead to learning difficulties later on. What are those specific learning difficulties? Is difficulty in reading, which we also called as dyslexia. 80% of them will have. Writing difficulty, which is also called as dysgraphia. And performing calculations, mathematical calculations, which we call as dyscalculia. So you will lot of time finds dyslexia, dysgraphia, dyscalculia terms being used instead of learning disability, right? And the important part is that these problems are the academic achievement will be low. Because of these challenges, the child will have problem in achieving their academic achievements to the age appropriate level or the expected level. As compared to their intelligence, they don't seem to be unintelligent, they don't seem to be low IQ children, but as compared to their IQ, they're not able to achieve those academic outcomes. So next slide. So what are these some of the factors that we need to keep at the back of our mind are that the child should have normal intelligence. A presence of normal intelligence is must before we go ahead and make a diagnosis of specific learning difficulty. Vision and hearing has to be intact. The child should not have any other impairments. Then the child is going to conventional, regular schooling, and adequate motivation and social and cultural opportunities have been given to the child. The child is not deprived of environment के उनका कुछ stimulation ही नहीं हुआ environment में, which has led to a child with difficulty. No, the child has to, when you take history, you find out that the child has good social and cultural opportunities, and he's got good exposure, environmental exposure. Then learning difficulty manifest particularly in early school years, somewhere from 6 years to 8, 9, 10, 11 years is the typical age group when you will find parents coming up with these concerns, and it is not attributed to intellectual disability or any neurological cause, any neurological origin. कोई neurological disorder इसमें reason नहीं होता है. It's a neurodevelopmental disorder. And there is no motor. Motor का मतलब hand में कोई problem नहीं है, arms में कुछ problem नहीं है. The physical part is all right. The child is not having problems with the physical के weakness है hand में, or the child has got some weakness in the fingers because of which the child is not able to write. That is not there. Absence है. There's absence of all those challenges. And these difficulties must be lasting for at least 6 months consecutively. That should warrant a diagnosis. If it has happened transiently, then we will have to wait and look at the symptoms, maybe stimulate the child, give some personal attention, and see But if these symptoms continue to persist for 6 months, then we need to think of specific learning difficulty. As I said, vision hearing is extremely important because in these early years is the time when the refractory error starts coming up. So a screening for their vision, ophthalmologist के पास जाके उनका eye checkup कराना is important कि कोई refractory error तो नहीं है, बच्चे को चश्मे की जरूरत तो नहीं है. बहुत बार when they cannot read the blackboard in the classroom, or they cannot read their book because of vision problems, then also they can behave like this. So those areas need to be made sure that they are all right before we make a diagnosis of specific learning difficulty. Right? Next slide. Now, yes, why we want to learn, all of us are here to learn about specific learning difficulties, because the magnitude of the problem is significant across world, across the globe. Different countries definitely have different prevalence based on how they collected data, how they were finding out what is their provision. So India, it's somewhere around 11 to 15% is specific learning difficulty. I'm sure Bangladesh will have their own percentages of prevalence. US has their own prevalence. So across the globe, the collective information says it ranges from 1.6 to 15% based on their age and the method how they were surveyed. But this 15% is not a small number. It's a significant number, and we can't miss on them because they can be managed beautifully. They can come up, they can lead normal life, they can achieve their skills if they are supported at the right time and diagnosed at the right time. So that's the purpose that we are having this show, this program today, and trying to learn about specific learning difficulties. Next. So yeah, so warning signs, we are going to study in some of these areas. We are going to study a little more in detail about what are the reading difficulties that we would observe in a classroom. If you are, some of you are teachers, you can note down some of these points because they will help us lead towards the specific learning disabilities. Then writing difficulties, mathematical, auditory and visual processing difficulties, some language difficulties, what kind of an history the child would give, what will be the language difficulties which we can observe in the child, how does the child plan and speed of action, the direction, intelligence, behavior, memory. These are some of the domains which may get associatedly affected in children with learning difficulty. And we are going to learn the symptoms in these areas today. Let's go to the next slide. So what is dyslexia or reading difficulty like? What are the symptoms that we will find? So the symptoms would be the child would be slow and unable to learn or read. The child may face difficulty in decoding the alphabets. P ko Q पढ़ लिया, Q को P पढ़ लिया, B को D को B. Decode करना is a challenge for the child. They will skip words when they are, or even lines when they are trying to read the text. They will misread. Instead of reading bud, they will read dub. Right? So they will misread the words. They will lack of expression when reading aloud. They will be struggling so much to be able to know this or read the word that they will lose the expression in that process. So there will be lack of expression. इतना struggle है कि punctuation, full stop, comma, exclamation marks, question marks, all these punctuation marks will be missed when they are trying to read, even though other children of their age will be able to read all this correctly, right? So they will, if they have read a paragraph in the class, but if you ask them, what did you read? What does it mean? The child will not be able to comprehend. They haven't comprehended. They were so busy in trying to just decipher those alphabets written on the page. So these are the typical concerns you will observe. They would avoid reading aloud in the class. If the teacher asks, okay, you stand up and read this paragraph, the child would want to avoid that situation. They may use finger like this. They may use finger word by word, alphabet by alphabet trying to read. Also, they may at times lose the pace at which they are reading. And eyes will move one by one, alphabet to alphabet, word to word. Reading words, sometimes was will be read as saw. Reverse reading, reverse, they'll reverse the word. On will be read as no, for, of. So 16 will be read as 19. So these kinds of challenges we will typically observe. Let's go to the next slide, please. Yeah, so these are the three components of reading which are classically affected. If there are teachers, educators, parents in this group, I would say look for these symptoms. How is the word reading accuracy? Is the child able to read the word accurately? What is the rate at which the child is reading? Very fast, very slow, or extremely slow? Reading fluency and comprehension. How swift and fluent the child is. Is he able to understand what he's reading or not? These three components need to be looked for. Next slide, please. And here's a beautiful example. If you can play the video for the audience, it will be a very interesting thing. Just let's see if you can play the video. Is everybody able to hear the video? Yeah, I believe there's less sound there. So this is an 11-year-old girl who's trying to read the paragraph written next to it. Even though you cannot hear, but you can see how slowly she's reading, how her finger is moving word by word. She has to pay so much attention and emphasis on each and every word that she's trying to read. And there's so much of confusion. If the audio would play loudly, you may be able to hear also that she's confused between BD. Like it runs out of the box, Rex looks for kid. So the words are also similar sounding and similar looking. So the child here is facing a lot of problem when reading. And they will try to substitute one word for the other, omit some because they find it difficult to read them. Guesswork will be there and fluency will be less. So these are classically the symptoms and signs that you would look for if you're suspecting a child with all these symptoms. Suspect dyslexia, right? Go to the next slide. Yeah. Then coming to writing difficulties, which we also refer to as dysgraphia. What happens here is there will be reverse letters and numbers, like B will be taken as D, P will be written as Q, 6, 9, N, U, those kinds of. Capital will be mixed with small letter cases, as it is seen in TABLE. So there's one capital bigger case and others are small case letters. Transposes letters or numbers. So instead of T write first, they have to write first. So they'll transpose and frisk ho gaya first. 124 has become 142. And this changes our answers in our academic performance. So these are the kinds of mistakes you will look or you'll find in their notebooks. They would write in reverse stroke. Sometimes, जैसे हम उर्दू लिखते हैं, we start writing from the left side towards the right. You may sometimes find children writing like that as well. And from bottom to top, wrong spacing and sizing of the words. Then they would copy letter, repeating or leaving out some letters and words. Handwriting will be extremely messy, at times too large, will not be able to write within the lines, and they will write very slowly, and they would probably the last one to be able to finish, or sometimes or mostly would come up with incomplete work. So when you find these challenges, keep in mind it could be dysgraphia or learning difficulty. Next slide, please. So again, there are three components in writing: the spelling accuracy, grammar and punctuation accuracy, clarity, and organization of the written expression. So it shouldn't be that you start from one corner and you get lost in middle and then you end up somewhere else. So the text that they are writing should have some expression, and all these three things should be impaired much more than what their peer is doing. So they shouldn't be close to the peer. They're far behind as far as their peer or other children of their age are performing academically. So then it becomes a cause of concern and we need to start looking. Next slide, please. So these are some of the examples. This is a beautiful note written by a 9-year girl with learning difficulty. If you can see these pictures taken from the notebooks of children with learning difficulty, you can see there is wrong spacing, messy handwriting, large, they are not able to write within the lines. And then there are punctuation errors. If you read this paragraph, written in the diary, trying to thank their mummy for taking them for shopping, you will not be able to really comprehend what the child is expressing. And the handwriting is very messy. There's no punctuation. And she's a 9-year-old girl. Typically, a 9-year-old can write a small paragraph, right? So go to the next slide, please. Yeah, so the third one is mathematical calculations and difficulty in mathematics, which is also called as dyscalculia. So what are the kind of symptoms that we can observe is they will have problem with the number sense, problem retrieving the mathematical facts such as arithmetic combinations or calculations, then difficulty with the language of math. So the questions which are written in text, reading those questions, arithmetic question, understanding them, solving them would be a problem. Word problems in maths would be a problem. Visual, spatial, and organization demands are there in maths. You have to write certain things on the first line, then the second line, addition, subtraction, division. The child will keep getting confused how to write spatially. They may reverse numbers. They may make very simple errors while reading aloud. By the time they finish reading the question, they haven't been able to comprehend. They need support there at times. These are the kind of challenges, if you observe, you need to keep in mind. And typically, a child with learning difficulty may have more than two: dyslexia plus dysgraphia, dyslexia plus dysgraphia plus dyscalculia. All three can coexist. Only dysgraphia can also at times is seen, but is a little rare to find. Only dyscalculia, extremely rare to find. Dyslexia is typically present most of the time in children, and these two can then occur together. Let's go to the next slide. So this is again an example how number sense is missing, and so the child has to write 1, 2, 3, 4, 5, and then 6. If you see the numbers on this side and the child has started writing, it's all jumbled up. The calculations are not correct if you closely look at those, and reasoning is not there. There is no fluency in doing these calculations, which typically children of 9, 10, 11 years old can do. Right? Next slide, please. So yes, I think Zahir has got a lot of experience on sensory processing difficulties. I would want him to take over and speak a word about sensory processing disorder, which is seen in children with learning difficulty. Do we have him with us, or we've lost his link? I'll continue otherwise. Oh, he's there.
Yeah, I'm back. Thanks, guys. I'm back there.
Yeah.
Okay,
Jahir is back. Yeah. So and I think that Masrat Mazid
I can
also
see the slide.
Yeah, Masrat has also joined.
Okay. Okay.
All right, and Masrat can take over this one. Masrat, you can take over this slide.
Okay, sir. Can you hear me? Yes.
Yes, Masrat, welcome, and she's from Srinagar, Kashmir, and she's a psychologist and neurodevelopmental therapist. So you can present now these slides, okay? Thank you.
Thank you so much. I'm pardon for my side. I faced some technical issues. Well, I give my brief introduction without wasting the time of much. I'm really thankful to the Faith organization for giving me such a platform. Actually, I'm a certified rehabilitation psychologist, is presently working in Compositional Center, Ministry of Justice, and Government of India. So we will later discuss on my with experience. Now I will take this slide. Zaid sir, can I take this slide? Okay, now this slide is all about the sensory disorder. Let's brief this with a definition so everyone can understand what actually sensory disorder is. It's a group of neurological disorder affecting the brain's ability to use information receive it via the senses to function smoothly in daily life. If you people can focus on this diagram, you will understand what actually sensory disorder is. Sensory processing disorder. Information via senses affected in three categories. Number one, sensory modulation disorder. It has subtypes like sensory under responsivity, sensory craving, and sensory over-responsivity. Sensory discrimination disorder, like most of the children's in school going children's, many faces these problems. Like if you see the sensory discrimination disorder, most of the professional or get not diagnosis on the proper time, they are you actually face it these problems like visual, auditory, olfactory, gustatory, and pre- proprioceptive and vestibular, tactile, and interoception. Most of the children are facing these problems. That's why they are not focusing on their studies. They are facing these problems during their school, and teachers are not actually get the right problem what children faced. So, next is sensory based motor disorder. This is also a disorder which faced most of the children, whether it's the autism spectrum disorder, whether the children are facing the learning disabilities or specific learning disabilities. Like this is the one disorder, maybe most of not giving that focus on this disorder, like this is a dyspraxia, and we will later on discussing on the other slides what actually dyspraxia is. This slide is actually highlighted the sensory processing disorders, and we will later on in detail explain these disorders. And sensory motor disorder like dyspraxia, and next to this disorder is a postural disorder. Postural disorder is very common among the students, whether they are in the classroom, whether they are in the tuitions, they actually face this disorder. Thank you. Next slide, please. I think Mr. Dr. Himani will take this slide. Dr. Himani, can you take this slide or I will continue?
Yeah, can you hear me? Yeah, I'm there. So the next slide, please. Yeah, so here in this slide, we have mentioned what are the kind of auditory and visual processing difficulties that we will observe in our children with learning difficulties. So the learning difficulty like reading difficulty, which we call as dyslexia, dysgraphia, dyscalculia. These three challenges exist with other sensory processing issues as discussed in the previous slide. And those out of those auditory and visual processing difficulties are more often seen in children, which again somewhere increase the challenge and the difficulty our children are facing. So what are those difficulties? The word will misbehave when they're trying to read. The word will misbehave on the page. As the lollipop they will read it as lollipop. Okay, the brushes. So if it is brushes, they'll read it as brushes. If it is hamburgers, they will read it as hamburgers. So the word is misbehaving for the child. They are not able to read it correctly because of the visual processing issues. The black and white paper is hard for the child to read here. They will experience a lot of eye strain and headaches when they are trying to concentrate and focus in deciphering what is written on the page. Slow to copy notes and read also slowly. Then difficulty in remembering the spoken words. If I have said something in sequence, the child will find it difficult to, will come in auditory. I've said something, do this, there's 3 tasks I have told. The sequence in which the child has to do those 3 tasks will be lost because there's difficulty in processing auditorily. Difficulty in organizing the words in their head to form an idea. Now, if I tell them, okay, you have to describe how did you spend your holiday yesterday at home, the child has to describe, but he will not be able to frame the story for how he spent the day. And he will not be able to put across his ideas or her ideas in meaningful sentences or a story format. That's organization of the words and the text will be difficult. Then sequencing the events will become difficult. The child will not be able to sequence them. So, for example, teacher says ba and they will hear this ba, and sometimes they will hear it as da, and maybe even pa. So that's misbehavior of the words for them. Auditory processing is a problem. Teacher said ba, they heard as ba, pa, da, any of this, right? So it's processing problem there. So these are the kind of problems a child will be facing, and at times they will express this when they're asked a question, when they're asked to perform, or when they're asked to write or read. So these are the next slide, please. So when we are talking of learning difficulty, these are some of the language difficulties which are again coexisting and can occur along with the primary reading, writing, and mathematical difficulties. What are some of those? Sometimes they do not appear to hear when you're talking. You're calling the child and the child is simply disregarding. They're just not paying attention. So that is the kind of lack of interest also, and delayed processing again. Difficulty in listening to one person talking when there is a background noise. A fan is going on at the background or TV is on, and if you are talking to the child will not be able to focus on you and neither on the TV, right? So unable to listen and take notes at the same time. Like most of the children, they hear the teacher and then they can write it down also. So this will be a challenge for children. Difficulty in following sequence of instructions, letters, what has come first, what has come last, unable to repeat what you just said and cannot remember things heard. So has problem associating letters with sounds. So phonologically also they'll have challenge. Remembering and pronouncing words which they've already learned. Even if they've learned words, sometimes parents will say, isko to yaad hi nahi rehta, ma'am. And a mispronunciation of the words will pin ki jagah pen, her, he ki her, they ka their, are. Those kinds of mistakes you will very commonly see. And substitute kar denga. Jaise tiger ko tiger, the j, don't ka dome. So these are the kind of challenges. I'm giving you examples so that, which I believe teachers or parents who have children with learning difficulty would have experienced it, and it'll be easy for them to correlate. But as a baby, sometimes what you'll observe when you go retrospective and ask their history, acha developmentally kaisa tha bacha, when did he start walking, crawling and doing, so a lot of children could have missed their crawling milestone. They would straight away go on to standing and walking. Lot of as a baby they will start talking later than the typically other children of their age would do, and they may not have any cause for that, but the parents may say, oh, he started talking at 3.5 years, doctor, he didn't speak before that. So speech delay ka history sometimes you can get in retrospect, which tells us that there are some associated language disorders and difficulties as well. Next slide, please. And then coming to the motor difficulties, it does not stop there. We talked of dyspraxia also. So motor dyspraxia is a very complex term. We will discuss that in future, but I want to make it simple for you to understand what are the motor difficulties. Gross motor, fine motor, and graphomotor. When you are writing, drawing something, the motor, the hand that you're using to draw is graphomotor skills. So child will be very clumsy, uncoordinated. Ball game, catch and ball khel rahe, badminton khel rahe. Everybody's learned how to play badminton. But my child is not able to learn because he's not able to hit the shuttle with the racket on time. So that gauging the time duration, gauging the distance, and the coordination of right and left side is something which is required when we play a racket game. So that is where the child will face problems. These are coexisting problems, and we have to work on them as well when we are managing the child. And do not sit up straight. If you tell them you need to sit straight in the class, they will either be leaning on the chair or leaning on the desk like this, or maybe sitting like this as if feeling bored in the class, always taking support. So the body language is also not so interested in doing things. and will either be clinging to the chair like this. Their legs will be rolling all around. And so this is the kind of symptoms and the body language that you will see. The child will hold pencil in an unusual way, ऐसे करके पकड़ेंगे या ऐसे करके पकड़ेंगे, different तरीके से पकड़ेंगे. And as I told you earlier, that they will miss on crawling. They'll start walking straight away. And as a child was late to learn motor skills, like small fine motor skills, जैसे button लगाना है, beads को thread करना है. These kinds of activities, the child, because they require a lot of coordination on our part. The child has to button and unbutton. So it requires coordination. This coordination is difficult for the child. That is why these activities will be a challenge. Learning how to tie shoelaces, differentiating between right and left. Aap bolenge right, give me a right hand, the child will get confused. Right concept, left concept. And even at a later age, when typically most children are very easily able to tell right and left, they'll get confused. So trouble judging the spatial relationship, hand-eye coordination can be a problem, and they might find problem copying shapes and doing simple puzzles. So because hand-eye coordination activities are difficult. So there again, visual processing, we need to work on visual processing. When we'll discuss intervention, that part will come in. Next slide, please. So behaviorally, what can we see? Now the child is running behind in so many areas and domains. The child is not able to cope up academically. At times the peer is running fast and the child is thinking, why am I not able to do it? It's parents mostly who feel pressurized. Oh, my child is not able to learn. Iska class repeat kara do, ye duffer hai. We speak so many wrong words to the children before even understanding what they themselves are going through. So they are going through a lack of confidence, despite being IQ-wise normal. Intelligence is normal here. But because of these challenges, they are feeling lack of confidence. They may misbehave to cope up that distress. They may either withdraw or they will be too naughty. हमेशा कुछ ऐसी गलती करेंगे कि क्लास के बाद रो करते हैं. Or they will totally withdraw. कोने में जाके बैठ जाएंगे, किसी से socialize नहीं करेंगे, friends नहीं बनाएंगे, because they'll always feel that my friends will make fun of me. They will refuse to go to school. At times they'll have some bahana or the other, मुझे school नहीं जाना है, homework नहीं करना है. So those kinds of challenges you will behaviorally observe. Slow to complete homework, unable to work independently. You gave him the worksheet, told him to complete, and when you came back after half an hour, the child is still at the first line. So these challenges can be observed along. They may avoid reading and writing tasks, prefer sports or arts at times. If they are all right doing those things, physical activities will be present. Inattention will be there. Sometimes they can have coexisting ADHD, and sometimes it could be inattention secondary to the fact that the child is having difficulty in doing the task. Right? So there, the role of a professional comes in, who will distinguish whether it is associated attention deficit hyperactivity disorder or simple inattention secondary to not having interest or not being able to do the task. Right? Next slide, please. Yeah, so now what is the school going to do? I think we'll give it to Zahir, that what actions the school can take, what actions the parents can take. He'll throw some light on that area.
Okay, thanks. Am I audible? Am I audible?
Yeah.
Perfect.
Yes, yes.
So what action is taken by the school? So the school is noticing that the child is obviously behind the peer group and is struggling quite a lot. And they have an inkling that there could be possibility of learning difficulty. So the way they go about doing this is get the child seen by a school psychologist for a determination. Various tests are conducted for type of learning disability that could be present in the child. Now, the tests do vary from country to country, from even city to city, because some city education authorities accept one type of methodology, another city may accept a different type of methodology. But in essence, some form of assessment is done to find out what type of learning disability the child has. So some of the tests that are often conducted are perception test and memory test, cognition and language ability test, attention test, intelligence and academic test, social interaction and aptitude test. From the results and IQ scores that the child obtains determines whether the child has these types of learning disabilities that are commonly seen. Development delay, below average specific learning difficulty, normal specific learning difficulty, or is the child gifted? So it's the IQ scores that determine where the child falls into with regard to a learning disability. Next slide, please. Dr. Imani. Dr. Imani? Okay, I'll continue.
Yeah,
so what actions do the parent take?
Yeah.
Yeah,
so
we carry on.
Yeah. So what actions the parent need to take? Okay, now the school has observed some challenges. They've spoken to the parent collaboratively. They have decided the child need to go for an assessment. They did an IQ test, then they did a specific learning difficulty. Batteries are there country-wise. I'm sure your country will have some guidelines to do that. And then you got some achievement tests done. Typically, these three are the kind of tests done. You can do a sensory profile also to know their auditory and visual processing issues. Assessment is done. We make a diagnosis that the child has learning difficulties. Also, then what do? We don't stop there. You must go and seek help from either a pediatric neurologist or development pediatrician or a child psychiatrist. Or if you don't find any of them, go to your general pediatrician. They'll also have knowledge about this particular area. What they need to do is they need to find out that these concerns are not secondary to medical ailments. That's the role of a doctor. They'll rule out whether it is a brain injury, a birth trauma, or is there any feature which is clinically looking different, like in a child with Down syndrome, or they have this mongoloid eyes, they have increased nasal gap, there is a semen crease. So there are some physical features in different syndromes which give us clue towards the diagnosis that it is not, probably there is some chromosomal error or genetic cause for these challenges, and it is not specific learning difficulties. To rule out those, because if there is a genetic origin, then we have to counsel the parent accordingly about the prognosis, कितना ठीक हो जाएगा, कितना improve हो जाएगा, इनका sibling होगा कल को, second baby होगा, तो उसमें तो नहीं है बच्चे को ये problem होने का chance. So we have to rule that out. Any muscular or neurological cause तो नहीं है साथ में, which is leading to these challenges. Hearing and visual problem तो नहीं है. We have to rule those out. Autism spectrum तो नहीं है बच्चा को. And malnutrition, chronic infection, epilepsy, or any kind of an chronic absence from school. All these need to be ruled out. How we do? We do a good clinical history, development history, clinical examination of the child, a diagnostic investigation, and the most valuable is psychological assessment, which the school either will conduct or the school can refer to a clinical psychologist who's trained to perform all these assessments and make clinical observations. All these put together will come to a final formal diagnosis and then guide the parent further on the course of action. Right? Next slide. Yeah. So I think, Zahir, you can take over from here.
Masrat, that's your slide.
Okay.
Masrat, are you there?
Okay, yes, I'm hearing you, sir. I will continue it. Now, this slide is depicting the specific learning disorders. Our sensory and cognitive-based co-occurring disorders that affect learning. What actually here this slide discusses how sensory and cognitive based co-occurring disorders that affect learning. Most commonly disorders which mainly found in the children who are having any specific learning disability, like first dyslexia. It is a cognitive based, which is responsible for perception, thinking, reasoning, and logic. Dysgraphia, dyslexia is actually a reading disorder where the children is mostly omit the words when they are start reading during the classroom or during the reading. Dysgraphia, it's also cognitive based disorder, but this is actually children who are facing a writing problem. They are like also facing the eye-hand coordination problem in dysgraphia. Dyscalculia is a mathematical problem. It is also a cognitive based. It's not a motor based, it's a cognitive based. Children are not able to make a minor mistakes during when they are doing the mathematical calculations. Now that the ADHD, the everyone teachers are knowing this disorder, attention deficit hyperactive disorder. It is also a cognitive based disorder, which is usually a very co-occurring problem among the children. And the last, that is dyspraxia. This is also a sensory based disorder. What are the attributes? They are all spectrum disorders, range from mild to severe. They cross over with one another, their comorbidity of symptoms, they lie with each other. We cannot come to know which actually disorder is, what is dyslexia, what is dysgraphia, dyscalculia, and dyspraxia. They must rule out here by the certified professionals. They cross over with one another. Comorbidity between specific learning disorder give rise to different traits observed. Specific learning disorders may be comorbid with other neurological, medical, and psychiatric disorder conditions too. If you're focusing on the diagram, like how they are overlap with each other, एक दूसरे के साथ कैसे आपको लगता है कि these disorders are connected with each other, the symptoms are overlying with each other, like dyslexia, dyspraxia, dysgraphia, and dyscalculia also, or attention deficit disorder and attention deficit hyperactive disorder, which is a really disorder, leading disorder, which may commonly found in the school going children. Next slide, please. Zahir, sir, you will take this slide.
Right. So in the previous slide, yep. In the previous slide, we talked about the disorders crossing over with one another, giving rise to different traits observed. So you can have a look at the diagram on the left-hand side, which is showing how the crossovers happen. So just as an example, if you see dyslexia and ADHD, the crossover shows lack of concentration and distractibility. So this is what we're talking about, that when crossovers are happening, we see a trait. But this trait, because it's a combination of, is masking what the real underlying difficulty or disorder could be. So what we see isn't quite the disorder that is playing a major part. It's the masking observed behavior that we see. So when they cross over, we see something different, but the actual problem could lie somewhere else. So that's the example I've given. So what do we need to do as teachers, as educators, as even professionals to a degree, is we make further observations of the traits displayed. The outstanding trait displayed is the starting point. So they say, okay, so it's hyperactivity. So we start off with the hyperactivity and say, okay, so we're going to work with this child to calm the hyperactivity down. But we know the problem could lie somewhere else. So once we've done that, then we keep observing and seeing what sort of changes the child is undergoing, and then have the ability to sort of change tact to say, okay, so he's doing this, but he's now starting to show this sort of a thing. So we need to change and modify the strategy a little bit to adapt to the new observed situation. So a singular strategy that we need to use, but more likely a multi-sensory. That is, we observe, we work with one. If there's an improvement and something else is showing, then we need to tweak what we started off with to accommodate that. Next slide, please. Masha, do you want to take over?
Okay, it's okay. I will take it. Now this slide, as Zaisa said, how it is overlapping with each other. What are the observations mainly we are doing? Now, effects of specific learning difficulties. What are the mainly effects which hamper the learning disability children's? Like specific learning disabilities can affect the overall educational performance of individual in learning and their well-being. This learning disability actually hamper their all educational activities. They are not able to concentrate, focus, or not able to give the span of attention. When the children are facing some learning specific learning disabilities, they are not give the attention, focus, and maybe sometimes they are doing the delay in writing, reading, and make the mathematical calculation, because their educational performer, always teachers are claiming that your child is very poor in the academics, but they don't notice that actually child is suffer from some specific learning disabilities. This is the common observations where the professionals have observed during their clinical experiences as well. Affect how auditory and visual information received, decoded, and processed by the brain. It actually happens when the children is facing some a specific learning disability, whether it's a dyslexia, dysgraphia, dyscalculia. These main three disorders are the highlighting of the specific learning disabilities. Most of the children are not perceiving the what is written at the book. They are not perceived as it is, or they are not able to decode the information they are received, or they are not actually processing the learning materials, whatever they heard, whatever they study, whatever they perceive. They actually have a sensory processing issues while they are learning reading and writing. And there's also a communication, speech, and language, both spoken and written. They face a really a problem if teacher are in the class. They notice it that sometimes most of the children try to avoid when they are asked for any question. They have issues with the speech and language, and when they are start reading, and they always face very problems. And next is memory. They are also facing the problem when they are come to the retain the information or recall. And coordination is the most important, which is commonly observed in the children during the classroom, like gross motor or fine motor. Gross motor, like they are not able to handle the big things like bag, bucket, and fine motors, like they are not handle the minute details, like they are not able to handle the cup handled, they are not able to handle the pencil, and they are make the coordination when they are supposed to write anything on the notebook. They make always the big mistakes. They are not able to where to start, where to end, how to hold the pencil, it is upward or downward. They also face these problems. And next is a behavioral problems. Always this is a common when the children are not able to meet the needs at the classroom. This is quite obvious the children are facing some behavioral issues, like they feel repetitive or inattentive. They always interrupt the another children who are good in the studies, who don't have any specific learning disabilities. They are always try to interrupt them, and they have a behavioral issues and repetitive. They are doing the certain things again and again, and they are not doing the any focus and concentration problems. And hyperactivity, as it is common among the students, are mostly it is also a part of the learning disability. And they always not able to sit at one place, always try to find the excuse to go here and there, and not focusing on the study during the classroom or at home, because they are facing the problems. They are not able to perceive, read, write, or properly. Now last is executive functioning. They are not able to do the functioning or execute the things, or multitasking or time management they face, and how to execute the function, and they are not able to do the most of the tasks. If they are right, they are not supposed to read. If they are make the calculation, they are not do any other tasks, but there is some concentration and attention problems mostly found in the children's. And there is also one most important thing, they have management problems, time management. Always they do the delay in the exams, they do the delay in what teacher gives them some task, just write it with the 5 minutes or 10 minutes, but they took sometimes 20 minutes, 15 minutes, and 1 hour, because they don't know how to write, how to perceive, how to read. And there's also a time management issue which mostly common found in the children who are having some specific learning disabilities. Next slide, please. Zahir sir. Zahir sir, will you take the slide or I will continue? Zahir sir, could you hear me? Zahir sir, could you hear me or I will continue?
Can you hear me?
Yes, I'm hearing you.
Okay, perfect. Okay, so we talked about comorbidities. Some of them are visible and some of them are hidden disabilities. So individuals with specific learning disabilities can have other conditions and disorders present in them, visible or hidden, that can impact on the mental, physical, and emotional well-being of the individual. So it's a lot more than just a learning difficulty, because now we're starting to see that there are other comorbid disorders that could be present, not all of them at the same time, but there's a possibility that they could be present. And these combinations affect at different levels. Some combinations affect academic level in specific learning difficulties. Some combinations affect behavioral level, language delay, hyperactivity, sleep problems, and aggression. So depending on what combination goes where, right, they affect each other differently. There could even be neuropsychological issues. Person couldn't dual task. Ability to switch attentions, memory recall, and cognitive deficit flexibility. At a psychosocial level, the self-esteem of the child may be low. Confidence can be low. Parental stress affecting them. Relationship difficulties. So depending on the comorbidities, it also affects them at the social level. And that's seen sometimes in normal life. Add to all this psychosocial, neuropsychological, behavioral issues. On top of that, some of the children could also have medical conditions as well as learning difficulty. Medical conditions like epilepsy, immune dysfunction, gut disorders could be present too. So it's a much broader picture that the kids can come along with to school. And this is something Dr. Himani will just elaborate a little bit on. Dr. Himani?
I'm so sorry. So children with specific learning difficulty can have various comorbid conditions, as we have learned in this slide. Like we can have ADHD. So it is when we start managing them, treating them, then we need to know that if we do not treat ADHD can be treated medically. For everybody's information, there are medications which can be given to treat it. And for children who are going to school, if you treat ADHD first and then you look into learning difficulty, then difficulty level already has gone a little squeezed down, because there that fidgetiness, hyperactivityness, inattention, that has reduced. So when you are managing, you always have to keep the comorbidities in mind, because we need to manage ADHD if it is associated. If we keep on doing remediation for the child, we are teaching the child with various method how to read, write, but we are not treating ADHD, then our outcome results are not going to be that great. So we need to treat ADHD along. If there is associated speech and sound problem associated, any language impairment, we can seek help from speech language pathologists as far as correcting the misarticulation and other sound and phonation problems that we would observe. So those coexisting problems, if there is an associated epilepsy, definitely any neurological, any medical cause has to be managed. Otherwise, it will increase the intensity of learning difficulty that the child is facing. Even psychological issues like depression, anxiety, if those are there, then we need to sometimes manage them through counseling, uplift the child's self-esteem, work on motivation. And maybe if the child has some extraordinary ability, like they like to paint or they like to create music, then harnessing those skills can motivate them, can keep their self-esteem up. And parents, when they are able to understand all these factors, they can not pull him down, watch that the child is not bullied, and keep them motivated and keep their self-esteem high in whatever things they're able to achieve, harness their skills. So those kinds of things have to be done. And when we are counseling the parents also, we need to keep looking for not just the difficulties that the child has, but also his positive abilities, his extraordinary skills that the child may be having, because those then become their harness to survive emotionally, mentally, and then gather success in life. We have so many famous people you'll get to see in a slide who had learning difficulties. So we have to look at a child holistically, not just focus exclusively in managing just learning difficulties. Everything has to be managed along with it. Yeah, I think we can go to the
next slide.
Yeah. Why do we want to know about comorbidities? Is because there are co-occurrence of problems. They will add to our challenges, academic difficulties. They will make the diagnosis difficult, so we have to treat them. They will delay the process of intervention. Hence, a holistic approach is required. The next slide. Okay.
Masrat? Okay, I think we're having issues connecting Masrat. Masrat, you there? Okay, I'll continue. Masrat can join in. So what we looked at is, now we're going to look at the key points. And ideally, the diagram on the right-hand side is a good summary, okay, which summarizes that children can bring along with them to school more than just a specific learning disability. So it's a bit more than that. This is what we talked about. They bring along learning difficulties, issues with reading and writing, attention deficits, ADD, ADHD, different intelligence ability, IQ levels, language issues, mental health issues like behavior and depression. They can be bringing along medical issues like cerebral palsy, epilepsy, genetic disorders, and they can have social issues too. So not only are we having a learning difficulty and medical difficulty, we're also having a mental well-being difficulty as well. So it's a lot that they're bringing along with them because of the dynamics that we got at the moment in general life across the world. Next slide, please. Now, as we said earlier on, specific learning difficulty also affects mental health or mental well-being of the individual. Again, looking at the diagram on the right-hand side, we looked at executive functioning. We talked about phonological processing, language, memory, visual processing, visual motor processing, attention. And then we looked at the mental health side of it, of low esteem, avoidance, stress, behavior, anxiety, depression. And then these cross over as well with one another and give rise to a different trait. So specific learning difficulty may be the root cause, but it goes on and creates something else along the way, which is an impact on the mental well-being. So that is something that all of us, be it teachers, medical professions, carers, even parents, need to be aware of, that specific learning difficulty moves on and could impact mental well-being of the individual, creating challenges for them. It affects the individual both in school and outside school too. It affects the self-esteem and confidence, affects the behavior and attitude. And because of the crossovers, it also, for the medical professionals, makes it very difficult for a diagnosis to take place. So we need, as parents, carers, professionals, to bear this in mind. So we got to really look at the broader picture of the whole thing, rather than focusing just on a element of learning difficulty, because it is much more than that. Next slide. Masrat, are you with us? Okay. Okay, the next slide is the key points. No, next, before that one. Okay, so from what we have seen so far, we can put this into perspective as the key points of specific learning difficulty in education. So looking at the slide in front of us, we see specific learning disability, commonly found in autistic spectrum disorders. The disabilities are spectrum disorders ranging from mild to severe. The other key point to remember is that they are comorbid with other disorders, be it mental, psychological. They could be medical, psychological, and mental. Affect each individual differently. That is the key. And this is why there is not a one-fit-all strategy, because the combinations are a bit like a curry, that if you want it mild and hot, you add particular spices extra and you make it the way you want. So these children are the same way, in that if you see a child, he may have different combinations and different levels present there. So this is why each child is affected differently. And the final point here is crossover with one another in different combinations. So no one child will have all the same disorders available there. No, because it's such a wide variety. It's what has happened in the development stages is how they're affected. So crossover with one another in different combinations. So it's a nice overview of what we have talked about so far, and what possibility the children can come along. And we've got now a good idea to understand that maybe we need to look at a multi-sensory approach, rather than just a fixed approach of one shoe fits all, or one type of approach fits all. It doesn't. We've got to be able to modify and change to suit the individual. And on that one, part one is come to an end. We shall be rolling up with part two in a minute or two. Nilofer.
Okay, so there are a lot of questions already in our comment box. So can we just go for like answering some of the questions? And I would request our admin to show some of the questions. Some are in Bangla, and some of the questions are very much related to Bangladesh context, that how we can develop or train our teachers, and also that our parents about these disability of the children. And I think that we can have another program, like we'll bring our policymakers also in other program, that they will answer this type of question, that how we can develop in our schools, or train our teachers, and also that our parents. Okay, actually they are giving so much pressure to our children, that okay, you have to do this, you have to go for the science, why you are not good in maths, why you are not the first boy in the classroom. So many pressures our parents are giving to the children actually. So I would ask my admin to show some of the questions that very relevant to our presentations, and maybe you will, Mr. Johir or Himani, that you will now decide that who are you going to answer those questions. So here is Mohammad Shafiqul Islam, that a question, that is there any studies related to critical thinking skills and learning disabilities among students? Okay, Mr. Johir, there must be some studies to critical thinking skills. Yeah,
I think that's more. There is. I think Dr. Himan is more adept to that point.
Yeah, I'll answer that.
You're muted.
Yeah. So what is critical thinking skills? First, we need to understand that. That means we analyze and we find out a reason for it. That is critical. It's our cognitive ability to decipher, critically analyze a situation and figure out what has to be done. That is critical thinking ability. So for critical thinking ability, we mostly require intellect, IQ, right? Cognitive skills. So cognitive skills in children will specific learning difficulty or problem solving ability is very simple word I would use. In children on specific learning difficulty is known to be average range. It's not, it can be average or above average. They do not have intellectual disability. Right? To get a diagnosis of SPLD, you have to have a baseline normal average IQ. So they're critical thinking, but in severe children with severe learning difficulties, and in the problem that we face in India is the just below average range. So less than 70 is fine, but children between 70 to 85 range of IQ, those are the children who do not typically fit in intellectual disability diagnosis, and they do not fit in SPLD diagnosis. So those are the sector of children who will have little delay in their critical thinking skills, and they will also have learning difficulties along. So those are the children who can have both the segments together, a child with a little below average intellect. So I think that's how I would put it.
Another question. Can you see the questions here?
Yes,
like,
we can.
What is the role of speech pathologist and special educator regarding learning disabilities? Who are going to?
I can answer that. So, we discussed in our previous slides that there were challenges in speech, the pronunciation, the phonation, and in the clarity of the speech. So a speech language pathologist can actually work on phonation, clarity, articulation errors. Articulation means where the child is not able to clearly speak. The phonic sounds of the words that are there, those are not clear. So they can work in that area. Special educator has tremendous role to play. They are the key stakeholders in this. They are the ones who are going to work with the child one-on-one and remediate them in these issues, in these challenges. They will take out different strategies, different form of methods of teaching them the same skill of reading, writing, or doing mathematical calculation. So there are different ways. We also call it as remedial tutoring. We are trying to remediate the child and use other multi-sensory techniques. So that special educator will use those techniques to help the child read or even write sometimes. So you all see Hindi movies, and if you all have seen Tare Zameen Par, it has extremely beautiful presentation of all the symptoms that a child can go through, and then how the lead actor is trying to teach him how to multisensorily learn different alphabets and then be able to read. So ultimate goal is achieved, that they are able to read. That is those special educators are the heroes here who are going to help the child, right? And next is neurocognitive strategies to improve maths abilities.
Math abilities and Iqbal, yeah.
Yeah. So neurocognitive is again self-explanatory. You have to build various strategies. Mental maths unka improve kar sakte because they are very good verbally. If you ask them a question, they'll do it quickly, mentally. Their vocational, their skills to talk, to express verbally. Sometimes they're excellent orators. You won't believe they cannot read and write, but they are superb orators in class. So that is what we need to harness. We need to find out that their extraordinary ability, that or something that they're good at. So again, neurocognitive strategies, various strategies we can use to improve their mental maths abilities. We can use alternative methods to teach them mathematical calculation rather than typically writing as 2 plus 2 4 and 85 plus 65 is this, right? Because they have problem in reading and writing. If they are doing it on an abacus or using Kumon or some other technique to do the calculations, then they are able to find the results. So equipping them to be able to do and get the outcome is something we're going to focus on.
Yes, in my school life, I have seen that.
If I can just come into that one.
Some are very not good in speaking, but good in writing. Okay, maybe so it's different to different people. Okay.
Yes.
So there is another question from Jubair Ahmed Pulak that
Can I
what
just
are considerations for inclusive course materials, learning disabilities? Yeah.
I think Zahir would take up that.
Sorry, I didn't get the question. I was just about to answer a little bit more to the previous question. And in a lot of cases, what tends to happen is this, that the educators teach the child in a certain way, okay? And each child is different. So to work out the child's learning style will be the key here, that how the child wants to learn. Because you can say 10 plus 10 and you work it straight down. You understand it, but to the child it's just above his head. So he's not going to understand it. But if you get a handle on how the child understands the instructions that have been given, whether it's verbal, whether it's auditory, okay, or have we got to show it as kinesthetically, then they're going to understand the question. So that is also a key when we talk about multisensory teaching. That is part of it. So that you teach the child in the way they want to learn. So if taking education said that's how it should be, but it's not a one-fit-all strategy. You can say verbally to one child and he'll understand it because he's an auditory learner. You can do it to another child, and if he's a visual learner, then he's not going to understand it as well as the child who's got an auditory learning ability. So the learning style also becomes a key on that point.
Sure, yeah. We need more special educators in our schools, educational institutions.
Actually, it's more finding the right areas. I think they, from what I have seen, there are a lot of special educators out there, but I think a lot of them may have just a one-dimensional view on things. This is how they've been taught. So it should come into the education system that is teaching it. It needs to look at that point because they're all coming out with the education that's been given at university or wherever, colleges, etc. And then they are implementing whatever they have learned from via the textbooks to call it mainstream, which is the public. But the ability to adapt, some learn it. We call it learning the hard way. Then they say, "Oh yeah, when I showed him, he understood it better." Then they start doing that. So the point here is that if in education they came out.
Zahir here, I would just want to add a little bit. that there comes the role of assessment. If you do a good assessment, then you can decipher what is, whether it's a visual processing, it's an auditory processing primarily, or where is the challenge is more, and how you are going to intervene. So assessment is the ground structure जिसके ऊपर हम building खड़े करेंगे. Once we have
it's basically across all sectors.
Yeah.
We've got the diagnosis, we've got the understanding, yeah, it has an ability, we know the IQ, but another assessment on top of that is the learning style of the child, and this is in education. So if we know the learning style of the child, then we can implement that, and then the results will be much better once we know the learning style.
In our schools, we have seen that, the teachers give more attention to the good students and not that much attention to those who are very quiet, and not giving that much attention to the, or maybe different. Okay, so teachers are giving more focus to the good student who are very, good in writing, reading, and very smart, and etc. Okay.
So I guess if you don't have too many special educators, training the same set of teachers to be able to screen children in every classroom in early school years is a great idea. Then you have to have psychologists and tools. Like in India, we use Nimhan's battery to do the kind of challenges that Zahid is talking about. Through that battery, we can actually figure out what are the main challenges of whether it's the memory, whether it's processing issue, whether it is visual processing, auditory processing. So deciphering that becomes easier. Then you check the achievement level of the child, and there is a tool by the name DALI, which was formed by National Institute of Brain Research Institute. I think it is also has a copy in Bengali. So I am not sure how it works, but if somebody can go through that, can form a similar tool in your language, in your country, and use it then for regular screening and evaluation.
So there is another question waiting for us, like what are considerations for inclusive course materials, learning disabilities, for that, Zubair? And
yeah, I'll come in on. I'll start off with that one. So when you're talking about inclusivity, I'll use the UK as example here. Is that if your child has got normal IQ for learning disability, they give a one-to-one assistant within the same classroom. Okay, so that is one way to come around it. Okay, the other is they give enough accommodations, like a bit more time. So if everybody's given half an hour, okay, the child has got 45 minutes. They get like 15 minutes extra for the task that has been given to the other children. So certain accommodations have been used in the classroom to help the child who's a little bit behind or has got a learning difficulty. So that's a possibility that in exams, you can look at that. Cost is an issue, but here in England, the government supports a little bit. So they have tools, as we were talking about earlier on, tools to help support them. So if somebody's having issues with writing and they're very slow, they have a laptop given to them through the school that they can use, so that they might be faster at typing, but not coordinated enough to write with, because they get tired. Dyspraxia is quite a common thing, a common condition that does happen. And with that, the gross and fine motor skills are a little bit difficult, so they'll always complain about being tired. So if that's the case and they're able to type, then maybe use a laptop. So there are accommodations that can be brought in to help children in an inclusive environment.
Yeah, something like similar to what we have. The examination board typically have these guidelines written, documented for schools to provide those provisions for children who have a learning disability. But the first thing that they need is a certification. They need a learning disability certificate from government authorities. That is once submitted in the schools, then they get all the accommodations which are as per the education board, where they will get extra time. They'll get a writer of the same age, same caliber, same intellect, maybe who can write their exam. They will verbally answer and the other person is writing, or they'll get a scribe, or they'll get a laptop as Zahir said. So they'll get some support or extra time to solve the problems or to solve the examination paper. So those are the kind of accommodations which can be formatted and they can be in place by the examination board.
If I can just add a little bit here, we'd earlier talked about.
Okay, Joy. Yes.
Sorry,
please.
I lost that sound. One point I would add here, and it is commonly seen that when the parent or the child is receiving any therapy, that's number one. Number two, in education, everybody needs to work as a team. Now, you commented earlier on that parental expectation is high. I have seen in India when I was visiting there that expectation is also high amongst the learning difficulty children too. Okay, and that is something that parents have got to accept, that they have got to work with the therapist and the educator in the for the benefit of the child. So no comparison. You only work with what your child has got to the best of their ability. With the therapists are not transparent, and that makes an issue. That's why therapies take longer, because sometimes the parents don't continue the good work of the therapist as well. So here, whatever accommodations, whatever situations are. Hello.
We can hear you. Jair, we can hear.
I have switched over. Okay, maybe you can hear me. I've gone off Bluetooth, so am I audible?
Yeah. Yes, Yes, sure, you are.
Okay.
Yes, Jair, you are.
So,
yes.
Parents have got to work with the therapists, the educators, and all of them have got to be coming together for the child, in the interest of the child. So everybody is on board, and this is a common sort of remark I have come across when talking to children with learning difficulties, and that is this, that, the pressure from the teacher, the pressure from the parent, okay, I can't take it, it's too much, but they know I'm not as good as the other kids. So this is something that parents, teachers, educators have got to understand, that child may not be at the IQ of the other kids. He may not be performing at the level of the other kids, but what if you gave him enough so that he's performing at his own level? That should be the key.
Okay, thank you, Johir. And we have to now we have to decide that whether we'll go for our second round of the slides, that already it's 10:30, nearly 10:30 in Bangladesh. So can we do it another day and answer some of the questions that's already waiting for us? Or suggestions from Johir and Himani?
I will go by that. We don't want to exhaust the audiences.
Yes, because already 10:30, and actually people, they have to go for dinner and for sleep and take care of the children or something like So we can take some of the questions for 5 or 10 minutes, and if you agree, then we can have another day for our discussion on the the second slides, okay, or second round of the slides.
Absolutely.
Rajini, you can come back.
Yes.
Hey, অনেক বৃষ্টি হচ্ছে ওখানে?
প্রচন্ড, কারেন্ট অফ হয়ে গেছিল। হ্যাঁ।
Hi guys.
And Masrat also now here with us. Okay.
Yes, hopefully I will connect with tomorrow without any technical issue. I got disconnected a lot of times, and I am waiting on the backstage for a lot of time. I don't know what is happening here. But I connect to switch to all Dr. Himani. They discussed the very beautiful questions and the Zahir sir. And hopefully I will connect with you people in tomorrow.
I think we've got an excellent audience who has so many queries to ask. I was so glad to see
Okay,
those.
there are so many questions. Like,
Yes, ma'am. And
I
I
have
think
these.
Dr. Himani, they are asking the very relevant questions. Like I just see a one visible question. I think it take a lot of time to discuss the eye-hand coordination difficulties while writing. We have to also show them how the children are facing the difficulties when they are supposed to writing. I think we will discuss it later on.
Yeah. It's a huge
Okay.
topic, a subject in itself.
Yes. And from Azkar Hussain, is there any tool for screening a specific learning disability for class or grade 9 and above? Please suggest.
In India, we
Yes,
use
there
DAL.
is. Yes, you can.
Masrat, yes, please.
Okay, yes, there is a one tool we are ongoing using in our country. There's a specific learning disability scale, which is for the age of 4 to 11 onward years, which is actually a specific learning disability tool, which is very useful for to detect whether it's a learning disability, what is a writing problem, whether it's a mathematical problem, perception, eye-hand coordination. Actually, this scale is very useful for the children in Indian adaptation. Maybe hopefully it has a version of in Bangladesh also. They can easily, teachers can easily administer and the professional can easily administer the specific learning disability tool, which helps us to just diagnose whether the children is having any type of specific disorder. Like they have almost 11 subtests in that scale, which give eye-hand coordination, perceptual, sensory, auditory, all are collectively or in that scale. I hope I am giving the such question to you answer. And Dr. Himani, if you have any other tool, you can add it here.
Yeah, I believe mostly what government recommends is Nieman's battery that we use for diagnosing, and that again has those lot of subsets. And there's another one, DALI, as I told you. DALI has screening tools also for the younger ones, 5 to 7 years, and then 7 to 9 years onwards. So there are two segments, and that tool is extremely simple tool to use, and school teachers can be taught to use that tool and do the screening. It is available in 5 Indian languages, and I think one of that is Bengali as well. So maybe you can try using that tool.
Okay, Dr. Himani, I think I will show in tomorrow's session. I will show you that scale. It is all about the perception, how they make the write, how they read, how they make the scale. I think I show will here so people can get the clear picture that there is a availability of tools that is specific learning disability tool.
Yes, it helps us to diagnose, and again, the information that we decipher out of that assessment helps the special educator to plan the course of action, what we need to target first to get the best
Actually,
result.
Yes. Actually, it is a key for the special educator.
Yes.
They are very confusion regarding whether the child is a slow learner, whether there is a delay in learning, or is this a really a specific learning disability. We are not supposed to diagnose any children in the classroom that you are having a specific learning disability unless and until we are not having an assessment from the certified professionals like psychologists, clinical psychologists, rehabilitative psychologists. They give us a clear picture whether children is falling in the category of specific learning disability.
Yes, absolutely correct.
Okay, there is
I
another
think we have
question
a lot of questions
from Deepa. In case of application of alternative co-teaching, will teach students with learning disabilities same curriculum, normal students? We can have same curriculum, I think, no? Just to give
they can have
maybe
a little
more.
modified curriculum. They can have a little modified curriculum, and some of the subjects can be dropped out, especially in certain classes. Like in India, they have to study 3 languages, so they reduce down to 2 languages for them. They remove 1 language, so the curriculum get modified. For certain children who have difficulty with maths, they can drop maths and take physical education instead, or they can choose some arts and music instead. So that can be modified according to the need of the child, and that modification actually can start a little earlier on, because then the stress on the child is less. But somehow in India also these modifications are available only from 9th grade onwards. However, once you get a diagnosis, the schools then have to work at their level to help and support the child in the earlier classes before 9th.
Yes, actually, Dr. Himani, I would like to add one thing here. The curriculum must be the same in the classroom, but it's the role of the special educator. They just try to modify the curriculum, same curriculum, but they just give the modification. They just make the strategies and tasks for the student. Like they have to learn only one sentence into the breaks or chunks. They make the goal, we call it in our short-term goals and long-term goals, which is especially for the students who are having a learning difficulties. They use some various strategies, right, through flashcards, through concrete material, yeah, through physical prompt. They make one book which make it full of tasks, like in 2 weeks you have to complete 2-3 sentences only by the efforts of the special educator. They make the curriculum same, but they make the modification according to his ability and attention, concentration, focus, and the ability of his mind, how the children can reach towards the studies. Actually, here the major role is the special educators. They modify according to their needs and ability, and how much the percentage of there is having in the specific learning disability. Accordingly, they make the strategies for the students.
How severe is the problem?
The question
in
from
the UK, they call this, and I'll just elaborate.
Yes, Jahid, yes, please.
Sorry, carry on.
About the curriculum. Yes, Jahid, please.
Okay. Just elaborating on what Masrat was saying, is this, that here in England we call it an individual educational plan. So all these sort of goals for that particular child need to be met. So when she was talking about what the educators need to do, is this, that if there's an individual educational plan in place for that child, then the educators can work with that a little bit better than having no plan at all.
Yes.
Yes, we must call in a short form. There's the IEP for the children. It's a different form, different IEP from the different students according to their abilities and performance in the learning process. We frame an IEP for every children in the same classroom. We don't need to separate the students. We just make some modification. We call it really in a special educator language. It's the individual educational program, which we manipulate for the children who are having some specific learning disability issues, ma'am.
Okay. So there is a question from Tanis Fatima Aini, that how can we strengthen the teaching facility in government schools for learning disabled children? So I can tell her that we have started this one like from Faith Bangladesh, and maybe we can work as a pressure group to the government that to have the teaching facilities in our schools also. But we need then to discuss with the policymakers of Bangladesh, or the Minister of Education and Minister of Social Welfare, or Minister of Women and Children Affairs. So Kaniz, আমরা ওয়েট করব যে আমরা যাতে করে আমাদের যারা পলিসি মেকার আছে তাদের সাথে আমরা আলাপ করতে পারি। আমরা ফেইথ বাংলাদেশ থেকে যখন এই বিষয়টা নিয়ে আমরা শুরু করেছি, আমরা মনে হয় আমরা আরেকটু দূর এগিয়ে যাব। Okay, and question from Sadia Noor, how to properly provide help for students with
Ma'am, actually, it is in India, it is an inclusive education, which is also for the government schools.
But we are still struggling to implement it thoroughly.
Yes.
But inclusive education is all for the government schools as well as for the private schools.
Yeah, it is there, it is documented, but implementation of the thing, we are struggling, to be honest.
Yeah, but somehow it is working somewhere. Most of the schools can run.
Teachers also need special training on that.
I think all
the teachers also, they need special training on that.
Separating out teachers, we should train everybody with these skills. Every teacher should be trained.
Every teacher should be. I agree with you. Agree with
Yes.
you, Himani.
Yes.
How to properly provide help for students with specific learning disabilities in the fine art classroom. Sadia Noor. Okay. So who is going to answer
Okay.
this question?
I'll start with that one, and this applies across the whole bit, not just fine art. Okay, what we do is look at the background, because earlier on in the slides, Dr. Himani talked about difficulties with black and white. Okay, and in a lot of cases, whether we are writing, coloring, drawing, anything, even on a mat that we're doing the fine skills, is a white background. Okay, which from my optical angle is creating a visual stress for that child. Okay, what if they tried a different background? Would the performance or writing or the ability to sort of sequence things a little bit better if the fine motor things that they're doing is on a color background rather than a white background? That's something that may be worth considering. Be it in reading and writing and even fine arts. It's just a point I thought would be useful here, because here the educators have got to now start to think a little bit outside the box. Here, a lot of the time from today's presentation, certainly, white background creates a difficulty. So what if there was a colored background? Maybe it's a thought that educators may need to look at as an accommodation in the classroom.
It depends on the perception of the students also, how they perceive the colors and the background. They accordingly make the art in the classroom.
Mm-hmm. Yes.
No, what I'm saying is it's worth a try. It's worth a try changing the color and see if it's a little bit easier, because end of the day, it has got to be easier on the individual to sort of like, they have the ability, we all know that, but something is stopping it. So what if this improved it 10, 15, 20%, for example, in the performance that they create? Then this has a knock-on effect that, especially when they go home, this is what we were talking about, that parents knock the child, so the self-esteem, confidence isn't quite there. But if it was 15, 20% improved, it's the circle of life, if you like to call it that, then changes, that he's getting the praises. With that praises, his esteem and confidence goes up. Then the child starts to perform differently and think differently.
Okay, there is another question on like children with autism and learning disabilities, because from Faith Bangladesh that we are working for the children with autism, and we had a lot of programs that we have like this pandemic situation also on like children with autism, how to deal with like they're in this time pandemic when they are at home, and how to treat them and how to train them, or like when the schools are closed. But here Arun Shah asked one question, that is that same strategy to make sure both for autism and learning disabilities, what would be different strategies take for learning disabilities children rather than autism children? So maybe with this question, after this answer of this question, then we can end for our okay today's program event today. So who is going to answer this question, like Himani or Asrat?
I can. Yeah. We both will answer.
We all are ready to give the answer to this question.
We already are. Himani, you go
can
first.
start. I think
Himani,
we have
Himani, you go first.
Everyone can contribute the answer of this question.
Yeah.
Okay, Himani, ma'am, start.
Put in an expert comment, right? So different strategies, what would be different? So basic strategies are the same. Having a schedule, having a schedule of the day, having the time fixed for doing intervention at home, taking support from therapist online. During all these times, COVID times, the basic rule of managing children is the same. But children on learning disability, typically children with autism spectrum have a lot of behaviors. different kind of behaviors. They have repetitions, restrictions, and they have obsessive behaviors. They have social challenges, social and communication delays. Those level of social communication delays are not seen in children with learning difficulties. So it becomes much more easier. All children with learning difficulties have normal IQ particularly, whereas children with autism spectrum can have below average or lower IQ levels as well, or sometimes very high. So again, the basic principle goes, you have to manage each and every child individually. You have to plan the intervention, or whatever the intervention planning you are doing for the child has to be made according to the need of the child. It has to be comprehensive, cover all developmental domains, start from the developmental level of a child. If a child is 4 years old, you are trying to teach him to tell a story, but the child cannot speak one sentence to communicate with you. So you need to start from the developmental level of a child instead of going on according to the age of the child, right? So these 4 or 5 principles apply in all neurodevelopmental conditions. Whenever you are planning intervention, you have to go according to the need of the child. That is what we call as individualized education, IEP को बोलते हैं. Okay, individualize according to the need of that particular child, and then modify the strategies according to the disorder. So yes, visual auditory processing disorders are there in autism also, in LD children also, but LD children have much better social communication skills. Their IQ is typically normal, and they will understand, comprehend your instructions, whereas a child on autism may not even comprehend your instructions, right? So there it is different. I think Masrat, you can add to this.
I think, don't you think they are the learning disability children are normal like us?
Bilkul, absolutely.
But there is a, we are not making some stigma in the parents like they are having some different issues. They are normal like us, but they execute their function. They execute function differently. Parents get worried, my children is having something serious issue, but it's not an issue. We can handle the specific learning disability children very easily. There are a lot of strategies. Even teachers can do the best at their classrooms by giving them some extra individual attention. They can handle them easily. They can give some space to the children who can do very well during their classroom. And whether we are talking about the autism, it is really different from the specific learning disabilities. Here we have to take a lot of efforts to make them understand, to make them learn, to make them follow the commands. And there are various different strategies for autism and the learning disability. They are not same. Here we do a lot of efforts for the ASD children. They are not able to hear, they not respond us very well, and it also depends on the severity of the autism, whether it is a mild, moderate, severe, or profound. Accordingly we will work with the children. And there is also a range in the specific learning disability children, whether they are the mild, moderate, severe, and profound. There are levels. If the children is having a milder issue, we can easily handle them by the special educator, by the professional, by the psychologist. But if the children is having a moderate level of specific learning disabilities, it means we have to do some hard work with them. And same is the case with the autism children. If there is a milder issue, it means we are giving them sensory stimulation therapies. We are giving them behavioral therapies, we are giving them speech therapy, we are giving them occupational therapy. Occupational therapy is especially meant for the children who are having all activities of daily living problem. We are giving these strategies to the children so they can overcome their daily routine problems. And this is not the very serious problem among the learning disability children. We have to just manage their learning difficulties. Anyone wants to contribute, they can. I think it is a 10:14 here. I don't know whether Bangladesh time.
I'll take 1 minute of your time, and whether we take.
Yeah.
I'll take 1 minute of the time, and we'll make it 10:15, and then everybody can go for dinner. And that is this: that whether it's LD, learning difficulty, autism, whichever level, okay, the order of the day is to manage them. And to manage them, we got to understand, as a parent especially, is to look at their patterns, okay, out the day. And just like, how we feel hungry, by 11 o'clock, pet mein gurgur ho raha hai, it's nearly lunchtime. It's a similar sort of a thing for them as well. So look at the patterns, where, when, and how is the key. So then to understand your child, okay, if he's at home or he's at school, in the classroom, and the child, say if it's in a classroom, the child is ADHD, for example. So that by 11 o'clock from Geeta's class to Hasina ma'am's class, he is not as good in Hasina ma'am's class, but he's good in Geeta ma'am's class. Okay, so that there's a pattern that by the time he gets there, he needs something to calm him down before he goes into the classroom. So patterns throughout the day then become a key and play a key role. So if you know what's happening, then at that particular moment, before going from class A to B, a little accommodation or just give him a little bit of a break and just let the air out, okay? And then he'll be ready to go back into the next class and maybe behave a little bit better. So patterns, be it at home, be it at the school, do need to be monitored either by the professional, the parents especially, because they're dealing in both situations, because they're from school, they're getting care, he's behaved badly, he's not doing this, he's not doing that. But then the teacher hasn't looked at his patterns. So the parent has got to cope with that sort of situation where a complaint of the child has come in. And then at home, if mom's at home, dad comes in, the child is hyper because it's that time. So maybe look at accommodations where, the child is a bit calmer when dad comes in and he's not as hyper. So it's a whole role of looking at patterns as well.
Okay.
Yes, actually we call it a routine therapy.
We have not heard from Rajni. Rajni, can আপনি কিছু বলবেন? আপনার কাছ থেকে তো কিছু শুনতে পারি নাই, মাঝখানে ছিলেন না। আনমিউট করে নেবেন একটু, রজনী।
হ্যাঁ, না বলতে চাইছি যে এদের যদি ঠিক সঠিক সময়ে আর্লি ইন্টারভেনশন করা যায়, তাহলে অবশ্যই এদের আমরা এগিয়ে নিয়ে যেতে পারবো। কারণ আমরা সবাই মোটামুটি বাড়িতে মা বাবা যদি ভালো করে নজর দিই এবং স্পেশাল এডুকেটরদের উপরে যদি একটু ভরসা করে ওদের সুযোগ করে দেওয়া হয়, তাহলে ওরা অনেকটাই এগিয়ে আসবে এবং ওরা অনেকটাই পারে, আমাদের মতোই ওরা পারে। লেভেলটা ওদের একটু বোঝার সমস্যা হয়, কিছুটা অ্যালফাবেটের সমস্যা হয়, বাকি যেটা হয় সেটা ওদের সাথে যদি একটু কোঅপারেট করা যায় ওরা খুব ভালো কাজ করতে পারে। এটা আমার মনে হয় এটা আমাদের বোঝার ভুল, তাই জন্য আমরা ওদের বুঝতে পারি না। যদি আমরা ওদের সাথে একটু কোঅপারেট করি, তাহলে ওরা আমাদের মতো নর্মাল লাইফ লিড করতে পারে এবং অনেক দূর এগিয়ে যেতে পারে।
এবং আমাদেরকে বোধহয় একটু দেখতে হবে যে
একটু সহানুভূতিশীল ভাবে, একটু নরম ভাবে দেখতে হবে। হ্যাঁ, একদমই তাই। কারণ আমাদের এখন ইনক্লুসিভ স্কুল হয়ে গেছে, যেখানে স্লো লার্নার বলুন বা যারা স্পেসিফিক লার্নিং ডিসেবিলিটি বলুন বা নানা রকম ডাউন সিনড্রোম, অটিজম বাচ্চারা একই ক্লাসরুমে পড়াশোনা করে, তাদের যদি আমরা একটু সময় দিই আলাদা করে এক্সট্রা, তাহলে ওরা কিন্তু সেই কাজটা, সেই যতটা ওদের লেভেল, ওরা কিন্তু ঠিক পৌঁছতে পারে।
একটু যত্ন করতে হবে, অ্যাটেনশন দিতে হবে, সহানুভূতিশীল হতে হবে ওদের দিকে। একদম। থ্যাংক ইউ রজনী। আপনাদের ওখানে এত ঝড় বৃষ্টির সময় যে আপনি আমাদের সঙ্গে ছিলেন। সো মেবি we are finishing today. So thank you so much, our guest speaker today, Mr. Johir Ibrahim. You took the initiative first and we had the meeting, and thank you so much. Thank you so very much. And then
it's a pleasure. I hope
Okay, you are now the family member.
It was my pleasure.
Okay.
Sorry again?
Rajini, now I'm telling you that you are now the family members of our Faith Bangladesh. So that
thank you.
Maybe time to time we will contact with you, and we have some more programs for our audience, our viewers, those who are very much interested
Definitely.
to learn about this type of to discuss on this type of issues, because it's very new to us, to actually Bangladesh also. And thank you, Mr. Johir, Ms. Rajni, Ms. Masrat, and Dr. Himani. And thanks and very much appreciation to our guest speakers, you all, on behalf of Faith, for joining us. And if everyone is interested in this issue, we hope to organize some more programs with all of you. So I'm finishing here today. And thank you so very much. Allah Hafiz.
Thank you.
Thank you very much. Thank you.